Zytiga is a prescription medicine used to treat the symptoms of prostate cancer. Zytiga may be used alone or with other medications. Zytiga belongs to a class of drugs called antineoplastics, anti-androgen. Uses: this medication is used to treat prostate cancer. Abiraterone belongs to a class of drugs known as anti-androgens, anti-testosterone. Testosterone, a natural hormone, helps prostate cancer to grow and spread. Abiraterone works by blocking the production of testosterone, thereby slowing the growth and spread of prostate cancer. This medication should not be given to women or children. Dosage and administration. Recommended dose for metastatic CRPC. The recommended dose of Zytiga is 1000 mg to 500 mg tablets or 4 to 150 mg tablets orally once daily with prednisone 5 mg orally twice daily. Recommended dose for metastatic high-risk CPIC. The recommended dose of Zytiga is 1000 mg to 500 mg tablets or 4 to 150 mg tablets orally once daily with prednisone 5 mg administered orally once daily. Important administration instructions. Patients receiving Zytiga should also receive a gonadotropin-releasing hormone analog concurrently or should have bilateral orchiectomy. Zytiga tablets may be taken as a single dose once daily on an empty stomach. Do not eat food 1 hour before and 1 hour after taking Zytiga. The tablets must be swallowed whole with water. Do not crush or chew tablets. Who should not take Zytiga? The following conditions are contraindicated with this drug. Check with your physician if you have any of the following. Conditions: low blood sugar, low amount of potassium in the blood, high blood pressure, heart attack within the last 13 days, chronic heart failure, severe liver disease, visible or water retention, abnormal liver function tests, pregnancy, child PU class B and C liver impairment. Precautions. Before taking abiraterone, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of previous heart attack, high blood pressure, liver problems, diabetes. Before having surgery, tell your doctor or dentist about all the product you use, including prescription drugs, non-prescription drugs, and herbal products. Side effects: headache, hot flashes, joint pain, heartburn or cold-like symptoms may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects.